Hi guys, it's always good to see you. It's always good to speak to you. And this morning I would like to speak about ultrasound imaging, especially in early pregnancy. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with a special interest in ultrasound. And today I just want to talk about imaging in the early pregnancy. I would like to talk about early pregnancy from the last month, from the day of a last monthly period, the first day of a last monthly period to 8 weeks. Now, just to give some few tips, some few reasons why we encourage pregnant ladies to just do a scan during this period. One of the reason is we would like to rule out. We want to make sure there's a pregnant. The pregnancy is in the right position, is in the right place in the uterus, and not outside. The thing that what we call in medicine as ectopic pregnancy, because this is dangerous, and if it's not detected early, it can cause death. We'll also want to look at the entire pregnancy. We make sure that it's viable. That is, we make sure that there's a heartbeat in the growing embryo. At this period, we also want to look at the pregnancy to make sure that they're not multiple gestation. It's not 1, 2, 3, or 4, because when you do this kind of this particular period, we'll easily know if the gestation, if you have single gestation, twin gestation, triple gestation, or even quadruplets. At this time, we also want to look at the cervix to make sure that the cervix is long and closed and there's no abnormality at the cervix, so that if it's weak, then we can always refer the patient to a gynecologist, to the gynecological team, so that they can either do a medical intervention like putting up a stitch, a McDonald stitch, to make sure that the pregnancy can be carried up to term. We also want to look at the ovaries, make sure that there are no cystic lesions on the ovaries. We also want to look at the uterus to make sure there are no fibroids. There's no any other abnormality on the uterus, like a biconjugate uterus, a uniconjugate uterus, because sometimes ladies, you might be born thinking the uterus is okay or the reproductive system are okay, but there could be some other abnormalities, what we commonly refer in medicine as Mullerian duct genesis. So maybe you have two uterus and one cervix, or you just have one ovary. Such like things we like to look at it and just make sure that your uterus and the reproductive organs are okay. We also want to look at uterus to make sure that where the pregnancy is implanting is the right side, that there's no bleeding, there's no subchorionic hemorrhage, there's no threatened miscarriage, so that at least at the end of the day, after doing this scan in the first 8 weeks, we'll be certain that you are carrying a normal pregnancy which is viable in the right position, and that your organs, or your reproductive organs, the uterus, the fallopian tubes, and the ovaries are okay. We also want to rule out even if there's any other infection that could cause a miscarriage, that could cause any problem to your growing fetus. So when you're pregnant, my advice is get time, go to the hospital, have a scan done, so that all these things can be checked and can be ascertained. Thank you very much.